Hello students, in today's lecture we're going to cover content on mental health in children and adolescents. In order to really start a discussion on child and adolescent health's mental problems, I really wanted to first look at a broad theory. So as humans, the goal for parenting, and we're going to continue from our last module which was on parenting and then maternal health. As humans, the goal for parenting is to provide an environment for children and adolescents where they can develop and function optimally and adequately, especially when it comes to emotional, cognitive, and behavioral health. However, incidence of mental health among children actually goes back to the type of external factors that can impact the brain in a negative way. And those stimuluses that they received at an early time in life. And what you really see is rather be a stimulus positive or negative, whatever was the environment during those early childhood years, they make a huge difference on how the child's mental health status is going to be down the road. So let's look at what impacts them positively or negatively in regards to the mental health among children and adolescents. And that brings us to our theory that we're discussing in this particular slide. It's called the gene-environment interaction. And this is when two different genotypes, or in simpler terms, genetic makeup, respond to environmental variation in different ways. And that determines your phenotype, which is the way a child will behave or react to a situation. And again, this interaction, if surrounded with negative external factors, can impact the brain in a negative way. Furthermore, it's affected by something that is of key importance during those early years, and that is family relationships and family behaviors. So the follow-up questions to ask are those relationships satisfying, whether it be within the family or school? If, for example, a child is going to a toddler or toddler group in a daycare setting or preschool, what are those relationships like? And another follow-up question would be, is the child successfully adapting to their neighborhood, to their community, to their household based on those stimuli that they receive? Now, in order to reduce the mortality and morbidity that occurs due to mental health illness among children, it is very important to recognize those situations, those factors, rather be negative or positive early on, and to begin treatment early. Early treatment is always the key, and now I hope that you've started to see a pattern that in a lot of childhood-related issues, early recognition and early treatment is the key for the best prognosis. So in this particular slide, I wanted to go over some very basic risk factors for developing mental health illness down the road. Now notice that these are very broad and they are connected to all kinds of different mental health illnesses that we're going to cover. And also fair warning, since we are covering a lot of content in this particular lecture, it is going to be longer compared to our lectures in the past. So just to let you know ahead of time. But coming back to those risk factors, we're looking at anything from depression to anxiety to ADHD to conduct disorder. So we're looking at a wide variety. And based on that, all of these risk factors apply to any one of those mental health illnesses that we're going to discuss, such as family violence, abuse or neglect, poverty, community disruption, and as such, risk factors such as family violence, abuse, and neglect. And in those situations, the child will definitely find it difficult to cope with the situation they're in, the new family environment. And it all comes down to the availability of the parent in all aspects, physically, emotionally, mentally, to re-strengthen that child to be able to cope with those situations. We are also looking at poverty, which kind of ties in with this particular risk factor right here, that is poor availability of resources. And it is important to note that in a resource-limited environment, the likelihood of mental health and illnesses definitely increases. We're also looking at community disruptions, and that is, again, the impact of a natural disaster or a war or any other thing that really destabilizes a community, and furthermore, destabilizing families and homes. And we can see that happening very commonly in our surroundings, rather it be through the hurricanes that we see, the wars, and several other situations. And oftentimes that leads to a recent move or a migration for the family. So you're uprooting from your home, from the environment that you knew as home to a completely new and foreign environment. And that transition itself can be very stressful and overwhelming for a child, and thus putting a child at an increased risk for a mental health illness. Furthermore, marked or marital post-separation conflict between parents. So if parents are not getting along, if there is marital conflict going on in home, that can be a huge stressor and a risk factor as well for mental health illness. And then in a blanket statement, any other traumatic experiences. What can increase the likeliness of the mental health illnesses? It could be the risk factors, like we talked about here, and it could be resilience. So what exactly is resilience? And the way I like to define it is it's the child's or the adolescent's ability to fight back from a difficult situation. In dictionary terms, it's defined as the ability to recover quickly from adversities and difficulties, and how effectively is an individual able to bounce back from that negative experience. So there are different sources of resilience. The first one being high intelligence. Now, what exactly do I mean by that? Am I referring to a high IQ score? And in fact, it's a little bit more than that. It's high intelligence in terms of emotional health and emotional intelligence. More specifically, an ability to quickly assess and evaluate a situation and then coming back with a stronger solution. And even temperament. Is the child emotionally balanced? Are they able to look at a situation from an outsider's perspective and really determine what needs to be done? So I would like to say that high intelligence and even temperament kind of goes hand in hand in order to become one source of resilience. Then we have the commitment of the caretaker to the child's well-being and development. And again, that caretaker could be the parent, it could be the guardian, it could be a grandparent as well. But sometimes, some things where you just got to find a solution and make it work. Issues that comes up if the child is being raised in his own home by parents, grandparents, close family members, or in foster care. So all of those, whoever is in that role, are they committed to the child's overall well-being and development, and thus are able to have that strong mental status to be able to go through illnesses and situations. And then the last one is the strong social support for family and the caretaker. Now let's look at some of the types of mental health problems that we're going to discuss in our lecture today. There are several different types, and I've listed them all out over here. We're going to be covering those, starting with autism and ending with bipolar disorder. Furthermore, what are the treatment options that are available? And it's important to really explore, thoroughly research all kinds of treatment options. I like to start with non-drug related treatment options for mental health illnesses in general. Again, this individual psychotherapy. That is use of psychological methods such as regular personal interaction, cognitive behavioral therapy, and additional methods to treat an individual. You can combine psychotherapy with family education, specifically family counseling sessions, which includes the individual and the family to sit in one setting together and really talk about those experiences. And that has also been proven to be a great treatment option for mental health illnesses for children and adolescents. We also have psychopharmacology, and this is when we start to use medications and alongside with psychotherapy for treatment. There are also special education programs such as for autism, for anxiety, that specialize in one particular mental health illness and educating communities, families, parents, spouses about that particular mental health illness. And then there are treatment programs that are in two different types of settings. We have the inpatient residential treatment program, so more like a hospital setting, and then we have the outpatient care centers, day treatment centers, such as like therapist office, a psychologist office, a psychiatrist's office. So again, this is not an inclusive list, but it is to realize that there are several different treatment options available. And what exactly is our goal from a treatment regimen? And that is to enhance the child's adaptation to his or her environment, and furthermore to support the community's effort to accommodate to the child's unique differences. So starting with the first mental health illness, that is psychiatric syndromes and treatments, we're going to look at autism spectrum disorders. Note that autism and Asperger's are both included in this category known as ASD, autism spectrum disorders. In fact, Asperger's syndrome is a subset of ASDs. Autism has gone through a lot of research in the past, and from different resources, we've now found out that autism is actually a biological disorder with multiple etiologies, and there is one known biological marker for autism. Autism was actually emotionally induced. due to the lack of emotional availability of the parent, specifically the mother, to the child. And there was a term that was coined back in the day of known as refrigerator mother, which was a mother that was rather cold, did not show as much warmth to their child, and that impacting the child in a negative way, and being seen in the behavioral aspects of autism. However, we now know that that's not true. There is no evidence of parenting defects or emotionally induced autism, so the term refrigerator mother is completely incorrect. Furthermore, there's not one single cure of autism, and the prognosis really depends on recovery and illness and how well the child, how well is that recognized early, because autism, that is a developmental delay. So how early is that recognized? How faster is a treatment initiated? And also depends on the language development and the individual intellectual skills. So again, this slide summarizes a little bit of the content that I went over in the previous one. That is, how do we really identify autism and Asperger's syndrome or spectrum disorders? And that is that both of these are known as the spectrum of poor socializing ability. And in general, it requires education and behavioral treatment programs. Education could not be just for the child, but for the family as well. It may also require medications for anxiety, aggressiveness, or hyperactivity, some of the other symptoms that the child may be suffering from. Now again, like I said earlier, prognosis depends on the language development and the intellectual capacity at the time of treatment of the child, and how early is autism recognized and how early is the treatment initiated. The current research definitely lets us know that it is a genetic condition. In fact, there is a chromosomal abnormality on chromosome 15q11q13, and that has been implicated based on several twin and family studies and family research that has been done. There are obvious physical effects of these abnormalities during early childhood, and this results in actual structural and functional abnormalities in the brain that are then translated as behavioral expressions of autism. Do I expect you to know this chromosome's location? Yes, so it would be a very good thing to remember, 15q11q13, which is where autism's biological marker is located. Now that we've covered autism spectrum disorders, we can go ahead and jump into anxiety disorders. I'd just like to say anxiety disorder is, again, also a very broad category, and it has sub-disorders that we will also cover in our lecture today. In general, anxiety actually is pretty common and occurs in about 13% of children and adolescents in the United States each year. And when we talk about etiology of anxiety, it has three components. I like to call them a three-cause model. It has a genetic component, it has an environmental component, and it has a personality component, personality and temperament. The genetic component, so if a parent suffers from any type of anxiety, then the child is more likely to develop it too, so that means it's highly heritable. And the environmental component, this is a little bit more trickier, and it goes back to that gene-environment interaction theory that we went on in our first slide of this lecture. The environmental components are actually life events that occur in a child's life. It could be very simple events like rejection among peers that causes a long-lasting impact. It could be relationships that did not go well. It could be family situations. It could be assault that can definitely become a trigger for anxiety as well, and some of the other mental health conditions that we're going to talk about today. So those are all parts of the environmental component. And then the third one is the personality component or the temperament. And that is referring to an extreme shyness. I'm not referring to a regular shyness or an introvert personality, you know, just a little bit of shyness. I'm looking at inhibited behavior, extreme shyness. Something that actually causes extreme discomfort or awkwardness for the individual to engage in social settings, and thus causing that anxiety. So like I said earlier, it's very common. About 8 to 10% of the youth has at least one anxiety disorder. Now notice this. This particular statistic is different from what we just talked about in this one. This is, in generally speaking, that 13% of children and adolescents has anxiety disorders altogether. This one says that about 8 to 10% of youth has at least one anxiety disorder. So you could have more than one anxiety disorders that could occur in one individual, one child, one adolescent. So make sure that you're noticing the difference in between these two statistics. The problem with anxiety is that many times it co-occurs with other mental health conditions such as ADHD in children. It could be symptoms of depression or substance abuse in teens. And treatment is very effective, again, if started early. Early treatment actually reduces severity of the symptoms and the impairment that occurs when there's a complete blockage of functioning, whether it be in social settings or academic settings. With anxiety, the disorder can continue into adulthood if treatment is not initiated during childhood or adolescence, and it can become even severe as time passes by and the individual remains untreated and unattended. I wanted to look at specific causes of anxiety among children and adolescents. So what I did is when I found the data, I divided into 4 different groups. And again, with our course, we're looking at infants, we're looking at toddlers, we're looking at school-age children, and then we're looking at teenagers. So the 4 distinct age brackets within childhood and adolescence. What could cause anxiety for each of those age brackets? So the infants, it's very simple. It could be a fear of a loud noise. It could be losing that familiar face. So it could be, mother walking away for a while and the child feeling anxious and stressed out due to not having the parent around. It could be having that stranger in front or being in the arms of a stranger. That could induce large amounts of anxiety. And that's what we see for infants. When we get into the toddlers age group, it gets a little bit trickier. And it gets a little bit more intense. So, fear of the dark. This concept of believing in the unseen. So remember from our previous lectures, imagination is really developing during this stage. So, believing in monsters, or if, for example, if there was a story that was told about a monster or something that the child saw on TV, and then really just grasping onto that and believing that. It could also be separation from parents in that age. And then when we look at school-age children, so starting from preschool all the way till, right before teenage, it could be physical injury, it could be environmental things such as storms, such as social anxiety at school due to academic pressures, due to peer pressure, social settings. So there's a lot of stuff that's going on because school-age bracket is pretty broad. And depending on that specific age of the child, those fears causing the anxiety could be different. And then when we look at teenagers, and this gets a little bit more interesting because through time and time through research, we see that the stressors that cause anxiety among teenagers are always revolving around these 2 categories. And that is social evaluation in social settings, social gatherings, peer-related situations, and academic performances, being able to do well in school, test scores, college applications, acceptances, and things like that. So for teenagers, many of you who start college at the age of 18 up until you turn 20, you're still a teenager. So those 2 things we see time and time again that are causing stress and anxiety in this particular age bracket. Moving on to some of the other common stressors that are relevant to all age brackets, and that is, the first one that we see is divorce. That definitely impacts children and adolescents in a negative way. Moving away from friends and family, loss of a pet, loss of a loved one in a family, also breakup with a girlfriend, boyfriend. So I was being a little bit more specific here, but what I really wanted to use here is social relationships that are not necessarily working out in your favor. So it could be, a romantic relationship, it could be a friendship, both of which could be identified as common stressors. Poor performances at schools and tests. So specifically speaking, during high school, as a junior, there's a whole pressure to do well on your SATs or your ACTs or several other exams that you want to take, depending on where you want to go in college. And not being able to do well in those can be a huge stressor for students, oftentimes delaying when they apply to colleges because they're set on going to that certain place. Death of a relative, like I said, it could be a death of a loved one, a family member, it could be a close friend, anyone really. that the child or the adolescent is close to could be a common stressor. And then this one was really interesting, and that is the transition from one academic setting to the next one, to a higher academic setting. So uh, amongst in the school age children, we see it when the transition occurs from middle school to high school. We again see it when the transition occurs from high school to college. However, the stress from this transition is a lot higher than the second one that I just spoke about. I also have two really cool Hollywood references for you for these common stressors. So, moving away from family and friends. Pixar's movie Inside Out with Amy Poehler, and it was a great example of that, where there was this little girl. I'm going to click on this link just to let you see the trailer. Um, where there was this little girl who moved away from her original home in Minnesota to San Francisco, and how everything was completely different for her, starting from school, friends, her hockey team, the emotional availability of her parents, her not being able to express those feelings with her parents, and exactly how each emotion played a part.